Good morning, everyone. It's 10 o'clock, so we are going to get started. We are excited to have everybody on board. This is Karen Lampert, the Executive Director with the Domestic Violence Program and Sexual Assault Service, and I have with me Dia Cirillo, who is the Principal with Spring Consulting, and she comes to us with over 20 years experience in policy and community planning. We were able to retain Dia in this process due to a grant through the Tennessee Institute of Public Health at the College of Public Health at East Tennessee State University for their Healthy Middle Tennessee initiative. So we're very grateful to get this funding in order to provide this opportunity to hold these convenings, to get folks together to have some conversation around mental health and what that looks like for Rutherford County and how we can identify some gaps in services to address those needs more efficiently and effectively to serve the citizens and clients of our programs. So this particular webinar is the final piece of this grant project where we've taken the information that we've gathered from the planning sessions as well as the surveys, and Dia has worked very diligently to compile that information and provide this analysis for the report back, so then we can start thinking about what the next steps are and how we can take action on those. If you are having any problems hearing me, if you can type in a little message in the chat box, so then we can see if we can navigate any troubleshooting. And then I'm going to let Dia do a little bit of housekeeping as far as how to navigate through the webinar pieces for you.
Yes. Good morning, everyone. This is Dia Cirillo with Spring Consulting. Welcome to the webinar this morning. You will note that hopefully now you can hear us if you're just on the webinar platform, or if you've dialed in, you should also be hearing us. As we present the information, we invite brief comments in the chat feature. And we will be sure to read those off, so if folks are just on the phone, they know what we're responding to. After we present the findings, we will open up the Q&A feature on the webinar, and that you should have, as you're looking at your webinar platform, you should see the PowerPoint to your left. You'll see the chat function in the center where I have a message about dialogue capacity. And then just above that message, you will see tabs for chat, people, poll, Q&A, handouts. So we will switch to Q&A at the end of this presentation.
And also to note that we've posted the PowerPoint presentation in the handout section as well, so you can access that and print that off if you so desire. So just to give a brief recap for some folks who might not have been involved in the planning session in the beginning, we really were looking at a focus on the vulnerable population, but as we've kind of come into these conversations, we're really seeing that some of the mental health services gaps are for all individuals, insured, uninsured, low income, excess income. So we're really been able to broaden the conversation a little bit more to really get in depth from what's happening and how we need to move forward. So we've provided the objectives and from this project on the slide there that you can review, and again the benefits of the program of these conversations as well. So we'll let you read through those to just acclimate yourself with what we're doing. This facilitated process was through Spring Consulting. We retained Dia, so there's her contact information as well for the services that they have provided. So when we went into this process, we initiated a planning question: what opportunities exist to close gaps in mental health services in Rutherford County that will support individuals on the road from crisis to stability. So that was kind of our primary focus question as we moved into this process and engaged the folks to address that. We really wanted to try and engage a cross-sector of individuals because we realized that mental health not only affects the social service providers, but it affects education, it affects the workforce. And so we wanted to make sure that we had voices in this process from a variety of sectors. So we really appreciate all those that came to the initial planning session and engaged in these conversations with us. And we have a list of those folks on the slide as well. So without further ado, I want to get Dia on board here so she can start talking about what we found and where we're going to go with it.
Great, thanks, Karen. This planning process engaged several methodologies. One was a pre-registration survey. The second piece was a large format focus group, which had several activities. It was a half-day planning session. And we took a look at the environmental scan, sort of what's happening outside of the mental health system and how is that impacting the mental health system. We looked at, sort of a specific definition of the term lack of funding. It's a term that we all rely on a lot. And so that was a very helpful exercise. And then we conducted an exercise that looked at gaps, opportunities, and resources. And finally, the room broke out into about 4 groups, and there was some scenario planning that occurred. And then afterwards, we did a post-planning survey to really gauge how individuals who had participated in the planning session really were thinking about the discussion of the day. And there are 3 broad findings that came out from this planning process. I think the first is something that I think we all know, that scarcity characterizes mental health services for the uninsured, vulnerable populations, children, parents, seniors, and those seeking crisis stabilization. We heard about these the really limited services that exist for these populations throughout the planning session. Certainly symptoms of that are the comments that were made about a behavioral health workforce shortage, the large caseloads, that certainly funding and insurance coverage is a considerable obstacle to providing a system that allows people to seek stability and recovery. The second broad theme then, of course, is that fragmentation exists throughout the system, from referral to treatment to follow-up. This is very interesting to those of us who participated, is that throughout the dialogue, there were very few comments about quality. There were a lot of comments about where the gaps existed and that simply there were just no services. And so certainly the fragmentation becomes very apparent, so that the system itself is experienced as a very siloed system. Its components are very siloed, and that expertise, it's very much oriented to expertise. So the ER docs and the in-hospital team have no opportunity to really connect with counselors, who are working with young people, or how counselors work with young people, or what's happening in the schools. And so we have these sort of components that are not connected to one another. The third overarching theme that we heard was that limited knowledge and misconceptions prevent mental health services from being socially acceptable forms of care and impede the political buy-in necessary to expand its reach. That there were many comments, particularly during the environmental scan, the PESTO, as we called it, the political, economic, social, technological, and other categories of external factors that weigh in on the mental health system. And those comments really came out really identifying still a very strong sense of stigma around mental health and mental health services, that there is a palpable sense of NIMBYism, the not in my backyard, please don't put a service center near my house kind of response to mental health services. And then finally, that there's still that existing debate about, do services create dependency or do they ensure greater self-sufficiency and recovery? And so these are common misconceptions that have been around for decades and that do reflect limited knowledge of mental health services and mental health ailments themselves. So here's what we learned from looking at external factors affecting mental health services. In the political realm, what really came out, all the comments really pointed to the fact that without political buy-in, funding shifts from program to program and stigma regarding mental health services persist. We heard a lot about the discussion on expanding insurance coverage and how that gets bogged down in long-standing misconceptions of welfare and socialized medicine. So that was one point that came out specifically around how the political environment impacts mental health services. Under the social category, again, this notion of pervasive stigma and the limited knowledge about mental health conditions and services means that individuals don't know how or where to seek help without access to effective services or knowledge on how to access those services. Individuals are vulnerable to losing their jobs, housing, and falling into crisis. For some, this means interaction with the criminal justice system. Next, what came out under the economic lens is the very clear fact that mental health services are diminished by lack of funding. And the comments that came through on this theme were specific to the lack of availability, the inability to access services, reimbursement rates are low. It's very difficult to fund home visits or to get prescription drug coverage. All of these are, of course, a system of lack of investment, a symptom of lack of investment in the system. And then when we took a look at technological external factors that are affecting mental health services, really, the one point that came through is really an opportunity for this collaboration of providers, which is communication and coordination among providers can be improved through technology. And what came up over and over again throughout the large format focus group was really that Charity Tracker is a resource that should be taken into consideration. Finally, we got many comments as we were looking at external factors, and they really boiled down to comments regarding systems planning. And this is, this is a very strong reoccurring theme throughout the focus group, that fragmentation exists among providers and payers and impedes the process to match care to needs. So we really see that in how clinical care and life needs are not connected or coordinated through available services, that there are significant service gaps in terms of the need for crisis stabilization unit, for more beds, for school-based care, and in connection with individuals who are exiting the criminal justice system. I think it's very important to note the other comments that came out and that were grouped into this discussion around systems planning were really specific to the fact that the system is not equipped, the mental health system is not equipped to address comorbidity and the opioid epidemic, which we will talk about a little bit further in this presentation. At this point in the large format focus group on July 27th, after the discussion of external factors, it was very clear that a lot of individuals were referring to the lack of funding. And so we took a moment to define lack of funding. And what we saw were several themes, reoccurring themes that come back to us. And there are three reoccurring themes. One is care coordination and service enhancements, that mental health services must connect with life stabilizing support, specifically education, parenting and family, housing, and work. I think there was a sense that there really is a need to, increase school-based care, increase the CSUs, expand integrated care to address comorbidity, that there's a real need for service enhancements in mental health services in general. The next theme was coverage and rates. Again, we're looking at investment in the system. Several comments were made that TennCare must be expanded in order to cover more of the uninsured and increase reimbursement rates. There were multiple comments about reimbursement rates. The third theme that came out really spoke to supportive services, that counseling is needed in order to retain housing, excel at school, and make the transition out of incarceration. Folks were very clear that somebody is not going to keep their house if they're still struggling with a mental health crisis. Kids are not going to excel in school if they don't have access to the appropriate behavioral health provider that can help them focus. There's that notion of counseling supporting other life-sustaining aspects was very apparent throughout the focus group. The meat of the day was spent focused on defining gaps, opportunities, and resources. And what came out of that activity was really about 10 broad categories. And these will be familiar to those who were in the large format focus group, but also familiar to all of us who've been a part of this discussion. First and foremost, what came out was a strong commentary around coordination and promotion. Two other categories really fit into the discussion on coordination and promotion. One are supportive services, the notion that life-sustaining supports have to be woven, by counseling, essentially. And then the whole person and wraparound services was another lens onto this discussion of coordination and promotion, that without coordination, the system is very siloed. It's very difficult for an individual to make it from referral to treatment to follow-up, and that frequently providers, particularly crisis providers, are seeing, repeat clients in their own services, primarily because they're unable to get on track to recovery. So this gets at, the integration of counseling with supportive services, really gets at a whole person approach. What came out of that discussion was some very specific action items that, starting tomorrow could be worked on. These are great action steps. Create a centralized inventory. Really look at coordinating services with supportive services by leveraging resources like Charity Tracker or case management, promoting mental health awareness and wellness in the county itself to help reduce stigma and really give folks the tools they need to seek out services. There was a strong theme throughout the data, really urging a plan for change and the need to act on gaps. And we're going to take this on near the end of the PowerPoint, but some of these comments really emphasize the need to act. Of course, funders in the field have an important role in establishing and highlighting these issues and establishing investments for them. So activating funders is another approach here. And then finally, nonprofits can share space. There were a couple of comments about needing centralized mental health services so folks would know where to go. The next broad theme we heard about was service quality and availability. What was really interesting is that the strong theme of scarcity throughout the data, that there are not enough services for kids in schools, there are not enough services for seniors, there are not enough services for the uninsured, and that those who are exiting incarceration also do not benefit from enough services, counseling, is that the topic of quality is really tied to availability, that we received very few, and I will say of all the data we collected, 2 comments, which is of hundreds of data, really focused on actual quality of service provision. All the other comments really focused on availability and access, that there's just simply, scarce mental health services in Rutherford County. So this broad theme was tied to other comments that characterize the system, that there is a behavioral health workforce shortage, that there are not enough services for the most vulnerable, and that there are not enough school-related services. So some of the, and I should also add that another theme that came out was the absence of crisis intervention services. And I've put that into the final big theme, but it could also fit up here as well. There's sometimes a little more art than science to the categorizing of data. But what we learned from these themes around service quality and availability is that there are several activities and action items that can occur in short order that can really begin to address the scarcity issue. One is provide telepresence to assess clients. The next is really begin a campaign around jobs in behavioral health. Rutherford County happens to be very fortunate in that it is home to MTSU, and MTSU does have several departments that are dedicated to behavioral health. They have a psychology program, social work program, and the university itself is looking to invest in master's degrees, professional degrees. Third, another activity that can be looked at is conducting health and resource assessments. I think very specifically looking at crisis intervention was a preference for those who were participating in the discussion. But also, I think resource assessments looking at schools, looking at uninsured, looking at seniors, I think will be important to what the mental health system should look like here in Rutherford County. Finally, there were comments that vocalized the need to advocate for Medicaid expansion in order to ensure coverage of the uninsured. As part of this exercise, we looked at resources or ways in which organizations can leverage their existing resources or partner or provide programming. And one of the comments that came up is that, St. Thomas Rutherford could really take a look at what is the cost for caring psych patients. That kind of study has been done in other cities. I know a study that took a look at that and really looked at the cycling in and out of hospital beds and how that impacts the community service system. So there's some very good templates out there on that level. Next, we had the broad theme of intervention and prevention. Along with that is follow-up and referral. And I've grouped into that crisis intervention just simply because so many of the comments talked about that fragmentation in referral, treatment, and follow-up. And so really a lot of the comments also looked at, what are some of those transition moments of somebody going in and then coming out of crisis intervention. So what came out of that discussion that was very fruitful as action items were to train faith-based volunteers on mental health first aid. Another excellent comment came out talking about introducing peer support specialists for crisis situations encountered by law enforcement. And then, of course, there's a very strong comment about cross-training the crisis team with ER docs and trust point counselors so that there's a broader dialogue about who's a part of this full system as people are referred and are brought into crisis intervention and then brought out. Finally, there was a comment made about launching intervention services to families early. The next data that we took a look at was really the data in response to the post-planning questionnaire. In that questionnaire, we asked all 19 participants and those who responded to the questionnaire. We had, of the 19 participants, we had 14 provide responses to the post-planning survey. And one of the first questions was, in the respondents' opinion, what did they think were the top gaps, the key gaps that needed to be addressed? And as we can see from this slide on the left, that really the top three, but actually four, are no surprise. That people are most concerned about availability of services, be it for K through 12 students, for the uninsured, for the recently incarcerated. There were several comments about availability of services alone. Next, there were comments regarding crisis stabilization. And finally, the concern around care coordination and insurance coverage came in third as key gaps that respondents identified. In terms of identifying solutions to what respondents thought, in their opinion, were key gaps, the topic that received the most comments really spoke to systems planning. There were comments that talked about the need for dedicated mental health triage, or universal mental health, or teleservices, or mobile crisis. So as soon as individuals start talking about components of the system, they really are looking at a meatier conversation about systems planning, how it should work, what its impact should be. And then, of course, another solution that was really highlighted throughout was care coordination and the need to increase people's knowledge of services and mental health diagnoses. This slide takes a look at what individual, in their opinion, believe are the highest priority issues impacting the mental health system, and what should be the first priority of action for this table of providers to address. The highest priority was availability of service, second, care coordination, third, crisis stabilization. The first priority was care coordination. We asked respondents if they thought that this would be a worthwhile initiative to continue, and would they refer a friend. We received a resounding yes to both questions. We asked what folks thought about the planning process, and we received some very favorable feedback. Most importantly, I think this comment from the school system, as a school, we are not a mental health provider, I think really illustrates the fact that organizations that are not mental health providers, but who are required to address behavioral health disorders in their populations, really are seeking partnership and experts in the field to help provide the services they need for their populations. And this goes back to a comment that was made during the large format focus group about what is the value proposition for mental health providers in this discussion. And I think the value proposition for mental health providers is really that by partnering and creating a shared table with organizations throughout the community, including other nonprofits, other government entities, education, employers, is that mental health providers will gain allies for mental health services, and also the support to increase investments in the mental health system.
Yeah, I want to jump in and just add, as related to as a school, we are not a mental health provider. I think that's not only with the school system, but we're seeing that in the domestic violence field as well, where we're being called upon to continually train our staff in certain mental health service provisions, kind of as that frontline service provider. So I think that's affecting us as well. And that was really kind of the impetus to drive this planning session and drive these conversation, is that sense of frustration that, this is not what we're experienced in, this is not what we're expertise in, and how can we provide these services to the client in an impactful and disruptive way.
Thank you, Karen. So the next question becomes, what do we do about this? This planning process was developed to really identify what are shared themes, and from those themes to enumerate several clear next steps. And those next steps can be defined by 3 agenda items: empower and act, define, and engage. So the first opportunity is to empower a shared table of mental health and medical providers and other community organizations. It could be something like a mental health action committee, a MAC, that would allow for the community to focus on immediate activities. And we've talked about these throughout the presentation of data. Those immediate activities for action are the compilation and identification of an inventory or resource list of existing services, the implementation of mental health first aid, the utilization of charity tracker, and cross-training opportunities among the different expertise that really are present throughout the mental health system. Next is an opportunity to launch a collective impact process and plan that fosters learning and action. Collective impact is a shared table among cross-sector actors that develop specific measures of action and monitors activities to meet those measures, and ultimately to make judicious investments in new services or in realigning services. This is different from traditional strategic planning because what it focuses on is action and measurement and impact and judicious decision-making about changes, systemic changes, and about resource investments. Next, there's an opportunity to define key gaps in mental health services in Rutherford County. We are no strangers to the theme of scarcity in the system, that there's just simply are not enough services for K through 12 children, for seniors, for the uninsured, et cetera, et cetera. Now the question becomes, how do we measure those gaps? How do we gauge those service gaps? How do we look at crisis stabilization? Does that require a new building? Does that require just simply funding existing providers? What will it really require? And that's where, getting down to some very specific assessments could help this discussion. Under defining key gaps is the real need to develop a consistent and integrated approach to substance abuse and the opioid epidemic. This is a great opportunity for this table. There's already money in the state to address this. The country is grappling with this. Nashville's mayor has had her own recent tragedy with this. This is going to drive the discussion in mental health provision. And this is a great opportunity for a shared table to really get its arms around what this means for mental health services. Finally, as part of this action plan is the recommendation to engage key governmental and nonprofit agencies in promoting mental health awareness and wellness. This is really about normalizing mental health diagnoses and just the requirement of reaching out for services and providing information out there on how to find the right services. So what that would look like is launching a countywide communications initiative, engaging local doctors on specific protocol, partnering with the K through 12 system to promote whole person wellness and concomitant services, and enlisting partners such as the Chamber, the Park District, city and county officials. So from this process, there are two main takeaways. First and foremost, providers in Rutherford County can take immediate action to improve services by establishing an inventory and implementing mental health first aid. Second, is that there is a real opportunity here based on this planning process to launch a mental health action committee that can address systemic gaps very specifically and surgically through a collective impact process. We want to thank all of the organizations that spent time on this initiative and, filling out surveys and spending half a day with us as so that we could jointly identify what are common concerns and opportunities to close gaps in the mental health system to ensure that clients can make it from crisis to stability.
And I just want to step in quickly and just note that there are a lot of good things that are happening in the community already around mental health services. We have some excellent mental health services providers. We have the Guidance Center, we have Trust Point, we have a lot of private practice individuals, the VA hospital, those type of resources, the county initiating the mental health court, and really looking at how they can provide wraparound services to support individuals that come through that court process. The Homeless Alliance of Rutherford County looking at a social services campus model to serve the community, United Way's community initiatives. So I think there's a lot of good things happening. We wanted this process to really open doors and to begin those conversations across sectors. We knew that those conversations were happening in pockets, and so this was an opportunity to really bring folks together that might not necessarily have crossed paths with one another, to learn more about what was happening in relation to mental health services and needs. And so really we wanted this process just to be the initial stepping stone. So it's definitely not the end all be all process, and we know that there's some more work to be done, and we're going to continue those conversations and engage further stakeholders in this process, because we know there's a lot more people that can be invited to the table and be a part of the conversation. And just a quick update on the mental health first aid training. I've been in email contact with a gentleman with the State Department of Mental Health to see about providing some faith-based training programs around the first aid, mental health first aid. And then United Way has been in contact with some folks that can provide that same type of training, but geared towards youth, 5th grade through high school. So some more to come on that, but that is definitely some things that should be happening within the next 30 to 60 days. So, as far as our action items, we want to make sure that we are making forward progression on some of those, what we call low-hanging fruit items, to ensure that this process was not for waste of time or effort, that we really want to take action and not spend all our time on conversation. So just wanted to let you guys know that this is not over, although it's not a process that I will be leading. Primarily, we'll be passing the baton to those folks who have the capacity to really continue growing this effort in a united front. So stay tuned for that. We'll be continuing to reaching out folks to keep you updated on what's happening. At this point, if there are any questions from you guys, we certainly would like to address those in this forum opportunity. We have around 15 minutes or so. So we did get a comment. Thank you, Christine. Excellent process analysis and conclusions. Looking forward to hearing more from Rutherford County progress in this effort. And we will certainly keep Christine and Gina in the loop. They were our program officers for the grant that we received, and look forward to continuing to engage other funders in these conversations as well. So do we have any other questions, comments? Okay. Well, we will make the PowerPoints available to those who weren't able to participate in the session today. So we'll reach out to those folks and send that out. And again, the PowerPoint was in the handouts, and we encourage you to also continue the conversation with folks as you're out and about in the community, and know this is something that we collectively want to address and take action on. And I really feel like Rutherford County is a place that we can dedicate and some opportunities and really showcase to other communities what we can do to address this issue. Thank you all.
Thank you.